Unfortunately, many of us in Wrexham are acutely aware of our dental crisis, with 93% of Welsh dentists no longer taking on NHS patients. One local practice recently lost 3 patients in one go and had to reduce the number of its NHS patients by 25%. Residents have contacted me stating they're forced to take out loans to pay for emergency dental care because they're in pain. And worse still, some are performing DIY dentistry. Welsh Government contract reforms have left many Wrexham residents without an NHS dentist. Now, I've been working hard to ensure Wrexham residents have access to dental services that they deserve and need, so I wanted to give you an update. I wrote to the Welsh Minister for Health and Social Care in Cardiff to ask her how the Welsh Government is supporting dentistry in Wrexham, and her response was that if patients needed an NHS dentist, they should contact Betsy Cadwallader, who hold a live list of such practices taking on new NHS patients. But Betsy Cadwallader have said no such list exists. I then requested an urgent meeting with the North Wales Dental Services, who is acutely aware of the problems we're facing, and they have suggested a few options for people to consider. Firstly, if you are on an NHS dental waiting list and you need urgent treatment, you can call the practice and request that urgent treatment be undertaken. That treatment will just stabilise your problem, and any good dentist should provide that treatment and then reassess your position on the waiting list. Secondly, if you've been on a waiting list for over 2 years or more and have not had a checkup, you can request something called a non-urgent access session. This is essentially a checkup, and you can do this by contacting the PALS service. I raised concerns that some children are growing up without ever having sat in a dentist's chair, and pregnant women who need that extra support are not getting the care they need. As such, North Wales Dental Services is trying to establish oral health promotion sessions for children and explore ways to acclimatise children to the dental environment. In addition, the dental service in North Wales and Betsy Cadwallader are currently working on a pilot out-of-hours system whereby the NHS 111 service will facilitate access to emergency dental care. And the only way to establish if a dentist is accepting new NHS patients on their waiting lists, unfortunately, is to contact them directly. This whole situation is unacceptable, and good oral health should not be a game of chance. I'm committed to working with Betsy Cadwallader and the dental services to help deliver better outcomes for Wrexham's patients. However, the only way that improvement is to be made is to have your voice heard. So please fill in the health survey on my website homepage, and together let's send a message to the Welsh Government in Cardiff that healthcare in Wrexham is not good enough and we deserve better.